All right. Hello, everyone. My name is Dominga No, Technical Content and Team Program Manager at the Marfan Foundation. Thank you for joining us this global virtual conference brought to you by the Marfan Foundation and its divisions, the VEDS Movement and the Loeys-Dietz Syndrome Foundation. My co-pilot for this session is Andrea Friedman, Client Services Manager at the Marfan Foundation. Just a reminder, this session is being recorded. For our time together today, we will be using the Q&A feature built into Zoom to field any questions you may have for today's speakers. Please select the Q&A tab on your screen to submit your questions, and we will cover as many as possible at the end of the session. We are excited to have with us Dr. Michelle Flom and Anna J. Witjuk, my apologies, Witjuk, as our speakers for today. Dr. Michelle Flom is a professor of clinical mental health counseling at Xavier University in Cincinnati, Ohio, director of the Medical Trauma Informed Care Certificate Program, and a therapist, clinical supervisor, and consultant in private practice for over 23 years. A survivor of medical trauma, Michelle has dedicated her career to helping patients and providers manage the mental health challenges often associated with life-threatening medical events and living with chronic illness. Dr. Flom is a published author and consultant and has been featured in the media on the topic of medical trauma. Anna J. Witjuk is a 34-year-old writer, performer, and disability advocate based in New York City. She was diagnosed with Marfan syndrome at 3 years old, for which she has had 6 open heart surgeries between the age of 16 and 33, one of which was a near-death experience. Her work focuses on medical trauma, body image. Hello. Her work focuses on medical trauma, body image, and illness narratives. From 2023 to 2024, she ran a medical trauma support and writing group for people with Marfan syndrome. We welcome them for this session titled Understanding and Managing the Impact of Medical Trauma. Dr. Flom, Anna, welcome.
Thank you so much. Thank you for having both of us. I'm just very honored to be here.
We are so happy to have you both. And I am going to hand it over to you and head backstage. And absolutely, thank you so much for being here.
Thank you.
Thank you, Dominga.
Well, we will go ahead and get started here. And make sure that I know what I'm doing here. Anna, are you seeing this? Just want to make sure that we're good.
I see you.
You see me, but you do
I
not.
see you, but I don't see a screen.
Okay. Well,
She has to see a shared screen.
yeah, okay. See, we were hoping that technology would just work so well today, and then, okay. Dominga, I'm not sure. I guess I can try this one more time. I don't want to.
Something's happening. Yes, I see it now.
Okay, maybe we were just on a little bit of a pause there.
Wow.
So hopefully when I start the slideshow, are we good? Can you see the?
I do.
Okay, perfect. And I'm assuming.
And people in the chat say they can, so.
Awesome. Great. Well, Dominga, thank you so much for introducing us. I just want to kind of reiterate one other aspect of the introduction, and I think that Anna and I can really connect with this, and that is being an advocate for medical trauma. So for me, I always lead my introductions with being a survivor of medical trauma, and really, I came to this work very authentically with the traumatic birth of my daughter 20 years ago, and having come very close to losing my own life, and a lot of medical trauma as a result of that. And when I first started to kind of explore my own mental health challenges following that trauma, I quickly learned that there was nothing out there related to medical trauma in particular. And yet I understood my experience to be quite different from a lot of the other traumatic experiences that I was reading about, and some that I had lived through myself. And so I really wanted to take a deeper dive into my own experience. And then along that journey, found opportunities to help others. And as a clinician who sees clients and who's seen clients for 23 years, and many clients with medical trauma, it's been a real passion for me to share this work. So again, I just want to thank everyone for inviting us to speak to you. So I want to start very simply, and that is to really talk about trauma, defining trauma. I think we all have a lot of preconceived notions of what trauma is. A lot of kind of connotations, assumptions. When I talk with some people about medical trauma, they're sometimes their first response is, well, but trauma is for things like when you're in battle, right? When veterans kind of coming back, that's real trauma, and everything else is maybe smaller traumas. Or in the trauma world, and some of you may have heard this, but there's often kind of talked about the big T trauma and the little t trauma. And I really kind of struggle with that. And later in the presentation, we'll talk a little bit more specifically about medical trauma. But I really like to start with just this kind of awareness of trauma being any kind of wound. And that can be, a psychological wound, a physical wound, a spiritual wound. It's a powerful shock to our systems. And when we see it from that very kind of simple definition, we can really start to understand the depth and the breadth of this trauma experience. Anna, did you have anything to add there, just in terms of the basic definition?
Yeah, well, I think also I just wanted to add previously when you were talking about how you yourself came into awareness of the idea of medical trauma. I think of, my own experience, the same thing, finding your book in the same way of like, I went through all of these surgeries and medical experiences, and even going through therapy myself, but not really addressing this very large part of my life of having a disability and a chronic illness. Finding my way to medical trauma was my own journey. And so I think leading up to finding your book and then just talking about this idea of like what defines trauma, I think of, so many ways in which my situation was not spoken about as trauma, but finding my way to this definition, a larger definition of trauma to the body.
Yeah, absolutely. And the validation that comes with that.
Yeah.
There's so much validation in naming our experience,
Yes.
having a name for our experience. And I know we'll talk about that as we go. So before we get into kind of more specifically talking about medical trauma, just kind of want to look at for just a moment some of the clinical signs of trauma. Regardless of the source of trauma, we can demonstrate signs of what's called traumatic stress activation. And really this is, you could almost think of this as, something that happens either outside of us or inside of us that can, for lack of better words, kind of flip a switch in our nervous system that activates our, either, it activates our trauma response. So that can be the fight, flight, flee, freeze, certainly, and the fawn response are just a few of the ways that we respond when we are in any kind of traumatic situation. And then, of course, there are a lot of the clinical manifestations of that, some that we can recognize in ourselves, some that can be observed by others, or a combination of both. Some of these, as you kind of look at this list, are also symptoms of post-traumatic stress disorder. But again, trauma takes on so many forms and has so many different kinds of effects for us that, again, sometimes people think, well, I don't have post-traumatic stress disorder, so it must not have been trauma. And one of the things we'll talk about is the varied kinds of effects that people can have when they experience a medical trauma or even just a trauma in general. Anything jump out at you here, Anna, in terms of, some of these clinical signs of traumatic stress?
Well, I definitely relate to so many of these signs of trauma that I was one of the reasons that led me up to. I mean, I think you and I, in some ways, there's kismet happening of like you kind of defining this word medical trauma. I Googling 5 years ago this term medical trauma. I was like, is this even a thing? Because I'm feeling all these things. I have hypervigilance. I definitely avoid situations. I have intense emotional reactions. I mean, I remember after certain open heart surgeries, just like uncontrollable crying for like weeks on end right after surgery that like I didn't even know what I was crying about, but it definitely felt like some sort of release of something that I couldn't tap into. And irritability is a long one. Depression, anxiety, things that were ongoing that I was like, wait, okay, like these things are happening inside of me. I don't know what's going on. I don't know how to name them. Maybe it has to do with these extreme medical procedures and events that I've been through. So just thinking about like trauma outside of the context of the medical setting where we have all these feelings, but we don't know really what they are. I can definitely relate. And I have a comment about hypervigilance, but I think I'll save that until you actually start talking about medical trauma.
Gotcha. And I really appreciate, you sharing that. And I will say that a lot of the clients I see, they may initially come to counseling for depression or anxiety. And it's when we really dive into their stories and uncover many of their medical experiences, that they begin to see those experiences through a different lens. And I can't tell you how many times people have said things to me like, I never put those pieces together like that. I've never made the connection, in part because, when we're in the middle of something, we don't necessarily see things for what they are, or if we're not getting validation and help in putting those pieces together, when we've been traumatized, it can be really difficult to do that.
Yeah, difficult to just express what you're feeling.
Yes. And the other side of that is difficult to feel safe enough to express how we've experienced a medical situation. So, but I digress. I'll keep us moving along here. So, coming to medical trauma then, and beginning to uncover some of what makes medical trauma unique. So in my training, as a clinical counselor, I really think a lot about the context in which we live, and the interrelationship between all of the different influences in our lives. And, in a reciprocal kind of way, the influence we have on our environment. And it's that interrelationship that, in that training that I'm kind of coming to the table with, that really helped me to, for lack of better words, kind of dissect my own experience and trying to understand all of the the effects of my trauma in the medical setting, and to understand the various factors that contributed to that trauma. So in this particular diagram, we have the patient in the center of this experience, and the patient is experiencing all of the effects of an illness, a diagnosis, the procedures, the interventions, and medical staff certainly are engaged and intervening on behalf of the patient and with the patient, based on this particular procedure or this particular diagnosis or illness. And all of this is happening within the medical environment. And so these influences are affecting each other and creating quite a complex experience. And so medical trauma really is a trauma that stems from direct contact with the medical setting, and it develops through that complex interaction between the patient, the diagnostic experience, the medical staff, and the medical environment. And this can have powerful psychological effects, really due to, and this is a key, due to the patient's unique interpretation and experience of the event. The meaning making becomes really important. All of those factors that reside within the patient become really important. And I underscore this whenever I can when I'm talking about medical trauma. It is the subjectivity of trauma that we really need to kind of honor. That if something is traumatic for someone, it is trauma, full stop. Anna, do you have any kind of thoughts related to this?
Well, can I go back to the just like the hypervigilance? I had a question about that, that is something I struggle with, and I see some people in the chat said like, yes, I'm super hypervigilant. I think hypervigilance is an interesting manifestation of medical trauma. Like you could say hypervigilance for lots of, as a manifestation of a lot of different kind of traumas, but I think it's an even more complex one in a medical setting, which I've experienced, where it's like, we're taught, at least, I was diagnosed with Marfan at 3 years old. I was taught by my doctors, by my parents, other people, like you have to be aware of signs of something going wrong in your body. If you're feeling a pain in your chest, if you're out of breath, if you're feeling faint, like these are things that we do want to be aware of, and have sent me to the ER, or were, this past October was a sign to me that I was going into heart failure. But there's so many other moments in my life where countless of feeling pain in my chest, a little stabbing in my stomach, that sends me into just like my heart rate goes up. I start having all these thoughts like, am I dying? Do I need to go to the hospital? And can really send me into an anxious space. So I think, yeah, I just wonder what your thoughts on like a hypervigilance, and maybe what your personal experience from your traumatic event of like, how is there a way to discern what is hypervigilance and what is just healthy vigilance?
That's a great question. And this is, I think, part of the complexity of medical trauma is sometimes the threat is our bodies. It is that. So there's some work done by Edmondson that focuses on this enduring somatic threat. And so that would be, I think, worthwhile for people to really examine and learn a little bit more about, in terms of, how do we live a relatively, peaceful and balanced life when we're walking around with our bodies, and our bodies are the source of threat and kind of that traumatic stress kind of activation. And that's really challenging, because we're trying to really pay attention and do what our bodies need us to do. And sometimes there is something that's going on within us that we need medical attention for. Sometimes maybe not. It is not kind of to that level of threat. Something else that I see with hypervigilance is this real kind of need to, or the sense of, I need to protect myself at all costs, which sometimes can manifest in medical avoidance.
Yeah.
And in my case, in my experience, after having the traumatic birth of my daughter, and I had a postpartum hemorrhage and lost all of my own blood plus half that was given to me. And so, and by all of my, medical providers, was thought that I would not survive that experience. But because of the very traumatic interventions that they had to kind of enact upon my body for so many hours after I had my daughter, fast forward to after having her and beginning to try to pick up the pieces and heal from this, I didn't revisit an OBGYN for 10 years. It took me 10 years. And so part of that was that hypervigilance and that need to protect myself, to the point where I was avoiding, any kind of medical experience that could, even in the slightest way, kind of bring up some of those same reactions in me. So again, we could have a whole talk on, the enduring somatic threat, and it's such an important topic to, to talk about. And again, something that is really, makes medical trauma unique. One of the many things I think that, makes medical trauma very unique. So, as we kind of continue to think about those, unique qualities of this kind of trauma, as I mentioned before, this is really based on the subjective experience of the patient. And this is important because, when I was first kind of developing, some of my kind of my models and my thoughts about medical trauma, and I would talk to, some of my colleagues who, were physicians and nurses, and there was kind of this sense of some of them wanting to be more objective with being able to say, like, well, yes, if you go into cardiac arrest, or if you're going in for, a life-threatening medical event, or, you're having a major surgery, yes, that could, result in some trauma. But other things like primary care, going in for a routine checkup, we're not going to see trauma there. And from my own experience, as I just shared, having not kind of felt like I was able to go to, an OBGYN appointment, when I actually did go, it was incredibly difficult, and I was re-traumatized. And so here I'm in primary care, getting a quote unquote, just standard routine exam. And I was kind of fully kind of activated in my trauma system. So again, the subjective experience is incredibly important. And the fact that, medical trauma or medical experiences are going to be different for every patient. Every one of us, there are so many factors that contribute to our experience anywhere. But, in the medical setting, we specifically think about some of the risk factors that, would make someone perhaps more vulnerable to experiencing a medical event as traumatic. So things like pre-existing mental health conditions. The number one being prior medical traumas.
Yes,
Yes.
that's the enduring. Yeah, that's also not just the enduring threat, but the enduring somatic experience too.
Yes.
Of dealing with a chronic condition, for sure.
Yes. And, for many of us dealing with a chronic condition, we've been kind of highly engaged with the healthcare system since we were little.
Yes.
So the opportunity, that sounds like kind of a strange word to use for this, but the opportunity of having, or the likelihood, I should say, of having traumatic medical experiences is pretty high, when we've had to utilize healthcare services so much over the course of our lives, creates, a vulnerability. Then, the next I would say is that medical trauma, trauma in general is it's holistically experienced. It's not something that we're just experiencing in our nervous system, in our bodies, in our biology. We experience it psychologically. Certainly we experience profound effects on our sense of identity, on our sense of safety, on our sense of self worthiness. Our personality can be affected, our communication style. The list goes on and on in terms of how we're affected psychologically and socially, affecting our relationships with others, affecting our relationship with ourselves, spiritually, affecting um, our kind of connection to something maybe greater than ourselves, a sense of meaningfulness, a sense of hopefulness. And so,
I would add,
oh
I would
yeah,
add to that identity too.
identity,
A
absolutely.
change in identity, which they were talking about it in the grief group just before of there's a lot of grief and I think a lot of loss in medical trauma. And so losing a sense of identity or losing future planning because maybe another medical event's going to happen. Why would I plan for something? Why would I plan to have a family? Why would I apply for that job? Why would I go away to college?
Yes,
Um,
yes. And and that, certainly can lead to, profound depression, for people as well. I mean, these are kind of developmental crises that we are facing. And that's, um, eh, quite an important thing to explore. And whether, we do that in therapy, seeing a counselor, or with others, to be able to kind of name some of these experiences that we're having, and some of the fears that we have, and the ways that our lives might feel disrupted by maybe living with a chronic illness. Certainly, medical trauma is highly contextual. I mean, these are things that happen within the medical setting. So we experience a re-experiencing of trauma. Oftentimes, for many, it's every time they re-enter the healthcare setting. And so that, becomes a really kind of critical piece to look at in terms of kind of healing through medical trauma, and being able to kind of feel safe within a setting in which we have felt traumatized in the past. It's a little bit kind of, different than, say, and I use this analogy, which can be, quite an upsetting one, but I think it really drives this home that, if I were raped in an alley, and, kind of, left for dead, and someone rescued me, one of the first things they would do is pull me out of that alley and take me somewhere safe to be taken care of, and treated. And so many traumas can occur within the medical setting. And even though we kind of psychologically understand the difference between those two settings, we understand many of the differences in the context, our bodies don't necessarily know the difference. And I really feel that, on some level, our psyche or our spirit doesn't necessarily know the difference. And in my own case, that was very similar to what I experienced with the interventions to save my life. In some ways, it mimicked a rape, for 6 hours. The context completely different. These were people trying to save my life. But on some level, it was hard to distinguish. And yet I stayed in the setting for the next week with the same people there to kind of help me through and treat me. But they were also some of the same medical providers who, used these interventions to attempt to save me. And so that creates, quite a complex relationship between ourselves and our providers. It can create kind of a double bind for us, where, our, our quote unquote kind of saviors, the people who are there to help us and to treat us and to maybe save us, depending upon our situation, might be the same people who, in order to help us, use an intervention that can be very traumatic for us. And that's a really important distinction, with medical trauma, that we need to really pay attention to. As well as, some gaslighting that a lot of my clients talk about experiencing, an invalidation, of maybe some of their medical experiences not being believed, not being listened to. And so for many, these are interactions that they've had with providers throughout the course of their lives, if they're dealing with, living with a chronic illness. And so the invalidation is quite damaging, a damaging kind of part of the experience of medical trauma. And, really the other piece of it that I wanted to speak to is that medical trauma can also be viewed as kind of a disenfranchised kind of trauma. We are, as adults, we are socialized from possibly a young age to just endure, to submit to whatever it is that needs to happen to us in order to heal us, to save us, maybe. So as adults, we are very aware of this expectation. And, we understand what patienthood means. But there's a cost, that comes with that, in part, not putting the pieces together and recognizing that, wow, that medical experience I just had, that was traumatic for me. So many people really struggle to make that connection. Again, because it's, well, but I was there, and my doctor was there to help me. Certainly I couldn't be experiencing trauma as a result of that. And so that's kind of part of the disenfranchisement of this kind of trauma. And, one of the things that I and so many other people are trying to undo. And, the other piece of it too is if there aren't mental health assessments, if there aren't acknowledgments within the healthcare setting that, that we might be struggling, that our mental health might be at stake. If there aren't resources given, then we walk away, maybe kind of talking ourselves out of, or trying to talk ourselves out of the experience that we just had, like, oh, well, my doctor didn't say anything about, well, maybe I could, after this surgery or after, this intervention, maybe I could experience some depression, or maybe I could, really have some anxiety, or so, and here's some things that I can do about that. If we're not talking about that, then that's another way that patients will leave the healthcare setting and maybe kind of doubt themselves, try to explain it away. We hear a lot of comments like, well, but you survived. I mean, I heard that a lot. Your baby is okay and you lived. What's the problem? Sometimes in those words. And so that can be enough to really have us question ourselves in terms of the authentic reaction that we're having to a medical experience. And what are your thoughts on some of this?
Man, so many thoughts. And you've really, hit on so many of the points in your book that were so enlightening and validating, and I keep with me as I move forward in my own advocacy. And I think, just like touching on the disenfranchised trauma, I think, speaking of, there's a whole section in your book where you talk about like the literal torture of medical trauma that's not really spoken about. And we don't speak about it in that context. And again, I've also experienced the same reaction or feeling that like my pain is disenfranchised. you know, my pain is normalized and my pain is necessary. This is like what has been told to me, you know, because it is to save my life. And the saving of my life is held in higher esteem than the pain that I have to go through in order to save my life, and then all of the pieces that I have to pick up of my life afterwards. And that's just really not talked about. So there, I think the disenfranchisement comes from that real normalization, depending on, you know, when you're diagnosed with your illness or your issue. You know, some people don't have their medical trauma event until in the middle of their life, you know, but, you know, for me and for a lot of people who have Marfan and connective tissue disorders, you know, we've been treated since we were children. And I just want to touch on that too, that I think the disenfranchisement comes from that normalization of like being a good patient. Like this is another phrase that I keep coming back to in all of my work. And just the idea of being praised for being a good patient, for not showing your pain. But also on top of that, experience, like personally experiencing and hearing from other people that I have to remain a good patient and to not talk about, you know, either like, hey, that really hurts, or hey, that's really triggering, or hey, I'm really scared, because what is more important for me in that moment is to get the like life-saving healthcare that I need. I've definitely had moments where like I felt threatened by healthcare professionals, but because I'm in such a vulnerable state, you know, I'm hooked up to machines, I have IVs going, I have a huge wound, like can't get out of bed, I'm like bedridden, that I choose to sacrifice expressing my trauma and my fear and all my other feelings that come with it and my anger, in order to receive the care. You know, maybe I'm really in pain and I just need those pain meds. So I'm just going to shut up. I'm not going to tell them that I don't like how I'm being treated or that I'm really sad. And I'm just going to get that. Or you know, just feeling isolated and alone in a space. And so I think that too, like being a good patient is so much tied up with this idea of being re-traumatized alone, you know, in isolation. Like we're re-traumatized and silenced. We silence ourselves and we're silenced by doctors. So yeah, that's what I would add.
Yeah, absolutely. I mean, that was, I think, a really beautiful way too to describe um, what's happening in terms of our attachment system, you know, as patients. I mean, similar to when we're young and we learn very quickly the rules of living in a household and being taken care of by our parents, you know, so many of us, you know, unconsciously, we learn to follow those rules because we need to stay safe. We need to stay alive. We need to be taken
Yeah.
care of.
Right.
And as patients, even, you know, though here we are adults in this kind of setting, we're very vulnerable.
Yes.
And whether we recognize it or not, I mean, there's so much that we're likely suppressing in terms of what we're really experiencing, because I need this person to help me. You know,
Yes.
I need this person to continue to care for me and give me, you know, good treatment. You know, I want to survive this.
Right.
And so we, you know, we learn how to get those kind of basic needs met by, again, being kind of the quote unquote good patient. And we learn to silence ourselves in many ways. What also ends up happening sometimes is we disconnect from our bodies, you know, and many times I felt in my medical trauma that my body was no longer my own. Not
Mm.
only that, but I didn't necessarily want that body right now.
Yeah.
And that felt
Yeah.
safer to me
Yes.
to completely disconnect from
Mm.
what was happening to that body. And so you have a lot of healing to do when you've experienced medical trauma, first and foremost with yourself, um, and with that relationship with yourself and with your body. So I want to switch gears now, and I'm also mindful of the time.
Yes.
I want for you to be able to kind of talk a little bit about some of the topics that have come from your peer-led support group that you have.
Yeah, I also mindful of the time, and I really would love to get to people's questions too. So I'll do a quick summary of I started this group in the fall of 2023. It ran for like 7 months, once a week. Just happened to be 5 women who joined, all with Marfan. And I really wanted to focus on medical trauma as like the leading topic, but underneath that, a lot of other things that we experience as people with chronic illnesses and disabilities, which I also want to say about subjectivity with medical trauma. I just want to mention that I know that there are a lot of people out there with Marfan and LDS and EDS who don't identify yet or never will or want to identify as disabled or chronically ill. But a lot of my context and these topics that I learned more about were through larger disability and chronic illness advocates and writers and artists, and like a book like yours that really helped me to contextualize my experience with Marfan in my body. And so, yeah, the group, like, I brought topics, we did writing prompts, we did meditations, but a lot of it was also just about people in the group having a space after having felt relatively different iterations of isolation to come together and to talk about things that maybe they'd never been able to talk about with anyone else before, either with Marfan or someone else who does not have Marfan in their lives. So things like that, are repressed a lot when medical trauma is disenfranchised or not expressed. So like rage, grief, fear, huge topics, which I think everyone can relate to. And then chaos, which we talked a little bit about, but for me, the word chaos came from this really great writer, Arthur Frank, who coined the term illness narrative, and he talked about the chaos narrative. And to me, medical trauma is so wrapped up in this idea of chaos, where I think a lot of reasons also why it's hard for us to come to terms with our experiences is because there's just so much going on in our bodies, whether it's like an extreme life or death experience or continued emergencies or just upkeep of our bodies, that the chaos of that can really be hard for us to like sit and stop and feel and tune in to what we're actually experiencing, or be able to express it to other people in an eloquent way. So I think just coming to terms with like the chaos, the continued chaos of our life, it's going to be there. It's not anything to get over. It's not something that you can fix. And then lastly, just the body image and self-worth, huge thing with the Marfan community. There was a whole other, last year's conference, there was a whole other group that talked about body image, but, and I could go on about that, but everyone here knows their experience with Marfan or EDS or LDS with that. But, in the context of medical trauma, I was thinking about like scars, in particular with my experience. I really love all my scars. I've met a lot of people that they find their scars from open heart surgery really shameful, and they hide them, and it's just another reminder to them of this awful experience they went through. Also, just like the way our bodies are continuously through surgeries and other chronic conditions are just deformed and maimed permanently, and especially at a young age, that can contribute to the continued medical trauma. So I think the takeaway for me was isolation is not good for these feelings, and finding community and a place where people can talk honestly with peers is like really important. So yeah.
Absolutely. That sense of kind of mutual validation um,
Yes.
is,
Yes.
is, is so important with medical trauma. Um, and of course, this is, a piece of your writing. Um,
Yeah, I can read it if
that would be beautiful. Yeah.
okay. This was from a larger report about the group that I shared with Michelle. And she put in here. So this is an encapsulation of my personal body story and its medical trauma. And it's just one example of what it takes to exist as a young person with Marfan. I use the word take deliberately and in two forms. Marfan can quite literally take from you. It can take your dignity, your joy, your hope of a future. It can hack and tear away physical pieces of your body. It also takes extraordinary resolve and endurance to commit to a body that you know will bring you pain. So much of my life has been about just trying to comprehend the war my body has been through, while also trying desperately to thrive and even celebrate the beauty that is all my body.
It's beautiful. I mean,
Yeah, thank you
that,
for including that.
yeah, I mean, it really struck me when I read it and wanted to definitely share. So in the interest of time, I'm going to shift into professor mode, when we
Okay, go ahead.
15 slides left and 2 minutes to go in class. But I wanted to just speak just very quickly, to some of these pieces, some of which we've already kind of talked about, and that is that medical trauma can have so many different kinds of effects for us. And we're not just talking about PTSD or anxiety, depression, those clinical effects, but just overall wellness. Medical trauma really can show up in every domain of life, from our physical and relational health, our jobs, our ability to engage in our hobbies and kind of leisure activities, relationship with self, as we've talked about, spirituality, certainly our financial well-being. So many pieces there that we can kind of experience those enduring effects of medical trauma. We also talked about how medical trauma can kind of show up anywhere. So it's not just showing up in the ICU and in the ER. Someone who's experienced a medical trauma, they're engaging with the healthcare system in so many different levels and in so many different ways. And so again, just to be very cognizant and kind of validating of yourself if you're struggling with going to these planned routine primary care kinds of experiences, and you've experienced medical trauma, that you deserve the same level of self-compassion and grace, to give to yourself as if you were going in for, a life, threatening potentially surgery. And so it's kind of all encompassing there. Wanted to say just a couple of things about treatment recommendations and just things to be thinking about. And I want to just highlight a couple of these. First and foremost, the support is so important, and that mutual validation, that Anna kind of expressed in the peer-led support group. These kinds of groups can be so effective because it can be quite isolating. If in our kind of community there aren't others who've experienced things like we have, we can kind of become silent, because maybe we believe that people won't understand or they won't necessarily have the compassion, et cetera. So, certainly clinical services can be helpful, counseling, some with a professional as well as with other supports. I really want to just reiterate in terms of my own journey that while I recognize that my trauma was holistic, I also recognize that the only way to heal through this trauma was going to have to be holistic. I wasn't going to think my way out of this experience. I had to engage my body. And so somatic therapies, complementary and alternative medicine can be really important here. Mindfulness-based therapy, especially to help with the enduring somatic threat. that we talked about. But I would also say self-compassion training. So mindful self-compassion is a really powerful set of tools. So I think it's not enough to say, okay, I need to be more compassionate with myself. A lot of us don't necessarily know how to do that. And whether we've had, a medical trauma or not. And so I've included some resources at the end here that you'll be able to kind of take with you. And I know we're recording this session, so you can go back and look at some of these resources as well. But again, mindfulness is such an important, I think, part of this healing journey, to be able to learn how to be very present focused in our lives and in our bodies without kind of falling back to the past or the future in ways that can really create more distress for us. And so I just really invite you to explore mindfulness. Like I've said, I've included some resources for you: mindful self-compassion, as well as mindfulness-based stress reduction. There's a resource here, the Palouse Mindfulness, which is the full mindfulness-based stress reduction training that's free. So it's the full kind of 8-week program. So I wanted to include a lot of resources that were not expensive or no charge whatsoever, to be able to do a little bit of kind of diving into some of these skills that at least for me, I found to be incredibly helpful. And I'll say, mindfulness probably saved my life in healing through medical trauma. So that's what I have. Anna, any last words before we
Well, I think your book is honestly incredibly accessible for, I know it's a guide for healthcare professionals, and it should be read by every healthcare professional, but I would say to everybody that I think your book is extremely accessible for the lay reader, and has a lot of really interesting like case studies, client studies in there too, of like examples of all different types of medical trauma. And I would tell anyone to read it. And then my other thing is just, you say mindfulness and I say community. Like, community saved my life. Finding other people with my experiences, and continuously, I mean, every time I find a new person, it helps to heal a little bit.
Absolutely.
So,
I think that's a beautiful recipe
yeah.
for healing through medical trauma, for sure.
Yeah.
I apologize. I have been incredibly emotional throughout this entire presentation. As someone who has Marfan myself, everything of what you both have been saying has been extremely validating. And I feel seen. And I know just by looking at the chat that a lot of our audience members feel the same. So thank you both so much for presenting today and being here and sharing so much, being so open. It's incredibly just heartwarming, and for a lack of a better term. So thank you so much.
Mm.
In that same vein, I am also here to ask some of the questions from our Q&A. So if we'll keep the resources up for a little bit longer, because that was one of the questions, was if there were any resources that touch on this issue. So thank you for that. Next one would be, where do you turn to help your loved ones who have experienced medical trauma? And even further, how do you guide and help your child when you know that the medical treatment is causing trauma, but they need the treatment?
Those are, such important questions. And I think, first of all, that your identifying medical trauma in loved ones and in children is such an important first step that you're seeing them, like you really, as, Dominga, as you kind of talked about feeling seen and then kind of taking it that next step. I think, certainly that validation it's like kind of a healing kind of balm, for us, because, so many of us have felt such invalidation. And so helping people to put those pieces together, and then coming together to decide, okay, so how are we going to together engage in healing? And so that can involve getting the help of a mental health professional who is specifically trained in medical trauma, who can really kind of do a lot of the work to help empower those who've experienced medical trauma. I think, any of these resources, and there's certainly so many others, that aren't kind of up here on the screen, can be very helpful in educating yourself first about medical trauma. I think that helps to then be able to help those you love. For the question specifically about children, the National Child Traumatic Stress Network is a wonderful organization. And actually, when I was first starting to do research about medical trauma, the only place I saw the term medical trauma back, many years ago was the National Child Traumatic Stress Network. And so I felt, at least through the kind of the pediatric lens, I felt like, okay, someone gets it, someone is kind of seeing this. Where I saw the big gap is that, adults weren't, it was almost like,
Yeah.
we are supposed to be able to just handle it. Okay, kids are more vulnerable, so here are a lot of resources, but for us adults, we're kind of on our own,
I would
so
also I would
yeah.
also add that, yeah, someone else asked again, like, how do we find mental health people trained in medical trauma? And I do think that's very difficult. Like you, Michelle, are like maybe the only person that I know, but I do think like keywords to look for when I've looked for support groups online, my own, I've gone to just larger, is chronic illness, chronic pain, disability. I'm seeing more and more, and even just body trauma, people who specialize also in like sexual violence. I feel like those are people who might be more compassionate and have more training in just like somatic therapy, that are words outside of medical, this very defined term medical trauma that you can search for, that I've found helpful.
That's great. And I think that's a really important point, that first and foremost, finding someone who is skilled in working with trauma. I've had people contact me from other states and even other countries and ask, do you know someone in Spain who, treats medical trauma? And so, I've had many people take some of, these resources to a clinician that they found who's highly skilled and highly, sensitive to what their clients are experiencing, but they want to learn more about specifically medical trauma. So, we are in the process now of educating more and more clinicians about medical trauma. And my next book, which I'm working on now, is a book that's specifically written for patients and for clinicians. So the, mental health professionals, like the treatment aspects of medical trauma. The first book was really to kind of get it on the map. Like this is a real trauma, and we need to pay attention to this. And now we're doing more work, to actually operationalize a lot of those kind of conceptual pieces. So yeah, I mean, that I think there's nothing wrong with, once you find a clinician who's highly skilled at, in working with trauma, and, give them some articles, say, this is what I've experienced, and I need your help to work through and heal through the trauma of this.
Amazing. Thank you for that. Our next question would be, How might one know when the trauma has exceeded certain thresholds, when additional help might be beneficial?
I mean, it's also an important question. I mean, I think, we tend to know when our level of distress has exceeded our ability to cope. We recognize in the different kind of domains of our lives that we talked about earlier, when we are struggling and we are no longer in balance. I would say, and again, I'm very biased as a counselor, um, that I don't know that we need to reach a certain threshold to reach out for help. I think when we're struggling, when we're in pain, when we, have fear, when we need help, having the compassion for ourselves to be able to get it, to seek it. Um, so, that's, I know in some ways that's maybe a little bit of a non-answer, or it's, I don't know that there needs to be a threshold to get whatever help you feel like you could benefit from.
That's completely fair.
To me, it also, I just want to say as a patient, I feel that question because I feel like that's in patient speak of like, how much pain can I take until I say no more? And I
Exactly.
wonder where that, that's taught, that is taught to us. And I think you should get help when the moment you feel like you need it.
Yes.
That's, Anna, you nailed it on the head. That's a societal expectation that is put on us
You
as
didn't have to endure anything.
absolutely and I really loved how you mentioned earlier the terminology that we all choose to identify ourselves. I personally identify as disabled. So to that point, that is a taught societal feeling that is put on disabled individuals for sure.
Mhm.
So thank you for that. And we have another question, which is a good one, if I might say. What do you do if your own doctor causes the trauma, but you still need to see them? How do you cope?
Mm. That's a really tough one, because in my case, I did continue to see my physician for, at least a couple of months. And then I gave myself the permission to not see her anymore. Um, that was really a critical decision for me. And again, as I mentioned, it took me almost 10 years to find someone new to work up, um, I hesitate to say courage. I mean, that's part of it, but I very much, did that very scared. So, there's courage involved, but so I would say to first really ask yourself, again, is this my only option? And sometimes we feel like it truly is, I mean, that maybe, but sometimes I think we can feel very trapped, and well, but this is the best, this, and we also have been socialized to just kind of take what we get in terms of, I mean, how many times have you heard someone say, well, the bedside manner is not great, but
Yeah,
person is a great surgeon or a great whatever, fill in the blank.
99% of the time.
Yeah. And I feel like we're just, again, those soft skills, as if they don't matter. And, I would say that so many people are re-traumatized, not because of, a scalpel or a medical device. It's because of something that was said to them.
Mm.
It was how they were treated,
Mhm.
and so the bedside manner thing, it's not a, well, this is not as important, but I mean, we're talking about our whole self, not just our bodies, but we've even kind of bought into that a little bit. Well, I mean, you know, this doctor, isn't very nice, or, the nurse isn't, but they're, they kind of know what they're doing. And so I would just say, just to first challenge yourself, do I really not have a choice? Do I really not have an option? And that's the first question, and then kind of beyond that, that's, I mean, people, I think there are a lot of different ways to kind of manage that. One being to get help and support, and to get, help from an advocate,
Yeah.
even someone who specializes in medical trauma. I've written countless letters on behalf of my clients to advocate for certain protocols being changed within, their healthcare experience, to better kind of account for, and to be more sensitive to their, experience, ultimately advocating for trauma-informed care, which I think should just be the baseline. Again, I'm pretty biased there, but I think everything should be trauma-informed, and because really that's about being compassionate, and that's, about, recognizing people's differences and people's needs and people's value and their worth. I could go on and on. I'm going to stop.
I also wonder what kind of trauma this person who asked the question is talking about. I know in Marfan and EDS and LDS, Marfan really was like the first researched, and then EDS and LDS followed that. They have there's newer research. It's just a newer space, and so finding specialists or people who specialize in your syndrome can still be really difficult. I mean, that was my experience as a child with Marfan. It's less of an experience for me now. Most doctors that I talk to know what Marfan is, in my experience now. But I do wonder what this level of trauma is, because if it's so unbearable, like maybe it's something to have to, talk to the actual, the space where you're getting treated, or to the doctor themselves, even though it's really scary, if you have to remain with that doctor.
Absolutely. That's a very great point. So that has come to the end of our questions for this evening, and I am extremely grateful for both of you being here. I did not expect to get as emotional as I've been, so I absolutely adore both of you.
Adore you, Dominga.
And I've just met you, Dominga, and I adore you as well. So love all around. Yeah.
You're gonna make me cry. Okay. Anyway, I have a job to do. Okay. So
Yeah.
many thanks to those in
Thank
our
you so
audience
much.
who have submitted their questions, and to Dr. Flum and Anna for so thoroughly addressing them. If you have any non-urgent medical questions that have not been answered here today, or you would like more information, please send an email to our Help and Resource Center at marfan.org/ask. We also, I am grateful that Anna shared her email in the chat. So anyone who has not seen that yet, please make sure that you jot that down. And again, thank you, Anna and Dr. Flum, for speaking to our community today. And thank you all in the audience for joining us tonight. Have a great night, and thank you. Enjoy the rest of the conference.
Thank you so much. It was a pleasure. Thank you.
Thank you.